Well, now a health alert and the growing concerns about the upcoming flu season.
Doctors are sounding the alarm after an uptick in flu cases overseas. They worry the latest strain could lead to spike in cases here in the U.S. We got Dr. Darien Sutton joining us now on this. And what countries are we talking about?
We're talking about the UK and Japan, where we're seeing some of these rises. Unusually early, unusually intense. Typically, we'd see the flu season start to ramp up, but the concern now is that the numbers are going up higher than we expected. And specific strains of the flu, as you guys know, the flu mutates and changes every year, but we're seeing specific strains that are associated with those increases. We're seeing early signs here in the United States, but important to note, the federal shutdown has delayed the collection of information and data and made it more difficult to predict these numbers.
So what does that actually mean? I mean, as we're ramping up, do we think that all of a sudden we're just going to see just so much information coming out, or are we not going to see the information at all and kind of leaving people guessing about the season?
Well, you know, private data collectors have showed that our levels are still relatively low. And it doesn't mean much, but my anecdotal experience in the emergency rooms, for example, here in the United States, we're not seeing as much of those viral illnesses, the cold, the cough, the body aches, and not seeing that present just as much just of yet. I'm talking to other providers across the country. They're not seeing those high numbers either, so I'm hoping that we're still at the early end, which means that we have time to get vaccinated.
All right. Well, raise my hand. I'm a vaccinated.
Yes,
right?
yes,
So am I.
yes.
That's a good thing. All right, we're going to change to another hot topic that's out right now. We're going to discuss some severe illnesses impacting infants linked to a baby formula recall. I know you've heard about this.
Yes.
13 children, including one in New Jersey, have been hospitalized with botulism. So what should parents know about botulism, first of all, and also this recall by Byheart formula?
Yeah, so it's a recall by Byheart formula. It's a recall of all their baby formulas. So you want to log on, check the lot numbers to make sure in case you're using this product. And that number is growing. We've seen so far 15 hospitalizations in at least 12 different states. What is important to understand here is that botulism is rare but very serious. It can result in paralysis. And what happens is that infants, specifically those under the age of 1, when they eat this type of bacteria, it forms a neurotoxin. And then that leads to the paralysis. So symptoms to look out for. If your child's having persistent constipation, difficulty swallowing, because think about all the muscles that are associated with that. And then if you look at your child, if they have droopy eyes or they have decreased muscle tone or they feel floppy, those are emergent signs that you need to bring that child to the emergency room. And important to note, although this is due to an infection, it won't come with a fever. And so it's really important to pay attention.
Okay. You really have to pay attention.
How could the botulism get in there?
You know, that's a great question. This is a form of contamination. So this is just simply due to a bacteria that then gets swallowed. Those spores that last are kind of, they're resistant to the processes that we use to help keep food safe, unfortunately. And then in babies, they don't have that healthy gut yet. They don't have that mature gut. And so that is why they're more susceptible to those problems, infections, and complications.
Okay. Thank you, Doctor.
Of course.
Appreciate it.
Well, it's a hot topic. Eyewitness News reporter Lauren Glassberg is going to have much more on the Byheart baby formula recall and what parents need to know. We'll have that ahead on Eyewitness News at 5.